Good morning, everyone. I am Dr. Pravalika. I am a consultant ophthalmologist from Sharath Maxi Vision Eye Hospital in Warangal. So today I'm here to talk about avoidable blindness-free society. So as we know, the visual impairment and blindness is graded into several categories, ranging from mild, moderate to complete total blindness. So, blindness can be categorized as avoidable and unavoidable blindness. And under avoidable blindness, we have preventable and treatable blindness, which should be our main focus because this is the category of patients to whom we can give some vision and improve their life quality. So, main causes would be refractive errors, trauma, cataract, and glaucoma. And as we've already seen this slide, the major load of blindness is still because of cataract. So as I've already stated, preventable blindness and treatable blindness together would be avoidable blindness, which is my main focus of the talk today. So the change in patterns in blinding from the past few years have changed because of aging population, and also there has been an increased global initiatives towards blindness, especially focusing on the lower income countries. And there has also been a rise of non-communicable diseases like diabetes, which have become major causes of blindness, and access to eye care has also improved drastically. So there is also the economic impact of blindness that we have on the society. So when a child is blind or has some kind of visual impairment, it restricts their education, and there's also an expenditure burden, especially in the rural communities. So that will all lead to an employment challenge. So to counter it, what are we doing? Our role as a hospital, as a doctor, is to mainly focus on cataract, childhood blindness, and refractive error because these are the main components and these can be treated or managed very simply. So, how we as a hospital do it is we try to make some villages as avoidable blindness free villages. So, this is a concept which has been developed to ensure that all the villages in the particular village, irrespective of their gender, caste, creed, they all have an opportunity to undergo eye checkups, and whatever conditions are there, we can treat them. So we defined our avoidable blindness as presenting visual acuity of less than 660 in the better eye. So this is our pattern, how we declare a village as avoidable blind free. So we identify a village and we prioritize a community in that village. So we sensitize the community, we do repeated surveys and health educations, and then we refer the patients with curable conditions to our base centers and we treat them. So those patients go back to the community and they try to do behavior change activities to the other public. And then after all of that is done, an optometrist and an ophthalmologist will again examine the patients, and any residual cases which are there will be cleared. And there are activities called participatory approach to community health activities that will be done. I'll be dealing with each of these again in the future slides. So our project covers a target population of 1 to 1.5 lakhs. So we continue to provide eye health services for 4 years until all the villages are declared as avoidable blind free. Then the village is certified as avoidable blind free village. So based on the existing service delivery coverage, we select a village and we have a team of women who are community health workers located from each of those villages or the surroundings. So they will be knowing the demographics and the people very well. So they reach out to every household in the village, and we also reach out to elected representatives of the village like the panchayat chiefs, and there'll be opinion leaders, youth groups, all these kind of groups. And we also take the support of government ground level workers like asha workers and anganwadi workers. So they're all involved in creating awareness and motivating the patients to undergo treatment. Villages with higher than 50% of the beneficiaries will be selected, and we try to mobilize the community, like we try to get the villagers to one point in the village and we explain the concept of avoidable blindness free village, and we tell them that their blindness is not permanent and it can be curable. So we also meet with the key stakeholders, like I've already told, like we meet the panchayats, school headmasters and asha workers and all of them who have a better grip over the local villagers. Then a trained community health worker goes door to door to verify the findings to see if there are any more patients. And the resurvey aims just to ensure that all the patients who have undergone treatment, we go see them again and we tell them, we see how they are doing. And also, if there are any new patients we might have missed during the last survey, they can also be covered. So, an optometrist or a vision technician usually visits and re verifies the findings. And very important thing for the sustainability of this practice is behavior change communication, because most of the patients, especially from rural backgrounds, they will be very scared to go to a hospital, and they do not believe what the doctors say, but they believe what their co-fellows say. So the other patients who have undergone treatment, they go and counsel the patients who still have to get surgery. So they motivate them. And these volunteers, they always act as a bridge between the villages and the referral point. So after all of this is done, a medical eye screening is done. An ophthalmologist visits the center and screens and examines all the patients. And the patients who need surgery will be prioritized and transported to the base hospital. And the treatments pertaining to all these disorders which can be done are all performed. And then they all come back for follow-up based on the WHO follow-up protocol. And we ensure that their vision recovery is on track. So, about the PACEH activities, or the participatory approach to community eye health activities, to understand that we need a few tools which will be preferential ranking, and we also do some semi-structured interviews and socially map the areas of blindness. So, all of these tools are done before the village is declared as avoidable blind free. Then we document the data of each village from the beginning till the end. So we have all the daily registers that the community health workers fill, and they're all audited. And it is very important, like I've already said, to keep this a sustainable practice. So for that, it's really important to have regular health education. Like the patients need to be educated about their health and their visual conditions. And screening programs will be held periodically, and reevaluation. And we need to own the community, like we need to go there and the patients will keep remembering us. So that is how we own the community. And if the volunteers from the community, they become a permanent referral point, so they keep sending more patients to us. After all of this process is completed and we decide that the village is avoidable blind free, we do a declaration meeting. It is a public meeting, it's kind of a celebratory meeting. It's attended by all the patients and their relatives and the village representatives, all the officials and local politicians. So after the declaration, a permanent board is placed in the village. It is usually placed in a place where it is stable and visible to everyone, like a school or a panchayat hall, etc. So these are the few villages that have been declared avoidable blind free by our hospital. So this is the picture of Muttaram village, the one Komatigudam, Makkapalligudam. All of these villages are nearby Warangal. So these are all the meetings that we have conducted. And we also felicitate the local leaders or the local volunteers who have helped us to achieve this feat. And we have partnered with Mulkanur Cooperative Bank. This was our first vision center, like sir has just stated. So these are our statistics. Thank you.